Hi, this is the Black Bear Prepper, and we're going to kind of be adding on to our first aid kits. You know, we're doing some first aid kits. You've seen our big first aid kit we do for our groups or kind of for events, things like that. I've discussed my backpacking kit, or my guide kit I call it, and you've seen the video on our individual first aid kits. People have said my big kit was too big and I don't want to go into all that expense, and so I said, let's go over the kit that is my kit for backpacking. So this is the kit I carry when I backpack. It is a heavy kit. This is not a light kit. There's a lot in here and there's a lot to it. This weighs about 4.5 pounds, okay? I could put a sleeping bag in for what I could with this. To me, this is the most important thing I take on any trip with the Scouts or anything else. My favorite kit. Okay, I take this thing goes with me everywhere. I first start out, I have a 3-minute kit, which is basically, you know, we have 3 minutes without air, 3 hours without shelter, 3 days without water, and 3 weeks without food. And the first one's 3 minutes without air or blood. So, first thing, easiest to get to, okay, is the combat application tourniquet, the CAT tourniquet. I keep one of those on top. I just have to tear it out of there. It's one of the good three-dot ones, and I've talked about tourniquets before. We're gonna have a video on tourniquets. I like this tourniquet because it's nice and light, easy to take care of, easy to put on, and I have it right on the outside. I have a safety whistle and a small pocket knife for being able to cut open things or whatever I need to do. If I want to cut out wrappers or whatever, I always have a little knife on there. And that's just a little Gerber mini, you know, great little knife, you know, one of their little lock blade, simple knives. And then I keep, on the outside, I keep a irrigator, a 60 millimeter or a 60 cc syringe irrigator in the little packs that are all plastic, so it keeps them safe. And then I keep a full-size 36-inch SAM splint, which I can cut for fingers. I could do for all kinds of things like that, so it's a real great way to have. So the things I think are hard to make in the woods, splints are very hard to make a comfortable splint out of a couple sticks. I have my tourniquet and my 60 cc syringe. Now, I have always thought of kits in two different versions. There's trauma, kind of more medium, you know, kind of hurried medicine, and then there's boo-boos. So what do I have first? What are we gonna do most of the time? We're gonna be putting on Band-Aids and doing small burns because we touched the fire or burnt ourselves, you know, something simple. We're not gonna be like patching up somebody's liver, you know. So first thing I have, all my kits are in otter boxes. I love the otter boxes. They take more abuse than anything else. I've dropped these off cliffs and rolled them down hills, and they just do great. Plus their buckles are detachable, lifetime warranties, but they can always send you just a buckle if you want, or you can interchange like I had on this one. I had other ones, and I just took the buckles off and put a new buckle on when I snapped them. So not saying they're unsnappable, but they are great, and they don't have the valve, and I hate the valve because they do leak. Now, why do I keep my kit in a full waterproof kit? I have had my kit trapped underwater for hours in the middle of a rafting trip. So it actually got soaked before I started doing this. So now I've taken my kit and I've put it all in waterproof. No matter what, I have my kit available. So let's kind of start out with what I put in my kit. The top here, also in waterproof, is my boo-boo kit. This is gonna be the stuff I'm gonna get to most of the time, and real easy to use, Band-Aids, things like that. So we're gonna kind of go over, I've got some cling tape. I have some Orajel, my favorite product ever, the anti-itch cream, your triple antibiotic ointment, your lip therapy, which is also great for burns, a 10 cc syringe for smaller cuts. You know, we really need to have that pressure to be able to wash out wounds and things like that, so something really good to have. And super glue. Now each one of these is velcroed in, and velcroed right to the roof, so it's not all falling out whenever I open it. I have benzocaine. I have my Vicks thermometers, which I really like. I love my Vicks thermometers. These are the individual thermometers. You just throw them away when you're done. So I keep a couple of those in there, and I keep my benzocaine, which is a benzoin, which is a skin protectant or prepping so the Band-Aids will stick to it. I keep lots of Band-Aids because this is going to be my kit I'm going to use for my Scouts or if I'm out hunting or whatever. So there's always lots of different size Band-Aids in here. I keep burn gel up here so I can get to it easily. Some duct tape. I've got some simple butterfly bandages in here. I keep some bigger pads in here, some 4x4s. Now, I do not do, I don't do a bunch of different sizes of gauze. I like 4x4s because I can cut them down. I have, I keep scissors in here. So instead of having 15 different sizes of every different kind of one out there, my 2-inch, my 3-inch, my 4-inch, I just buy 4x4s and I cut them down. Now Band-Aids are a little different. I keep a lot of Band-Aids in, different size Band-Aids in here because they are not something I can sit there and just switch out. I can't cut them down. Where I can with my, I can do that with my gauze. So that's kind of what I keep in the top. So that's going to be my easy to get to boo-boo kit. So Band-Aids, little nicks here and there. Now my kit is all based on being able to get to in an emergency. So I put all the things I think I'm going to get to first. The first one is going to be blisters. I have moleskin in there. I have more benzoin, which is a great product. Like I said, it's a skin prep so that your Band-Aids will stick. Something you can look up online, buy. It's fairly cheap. You buy, you pay like 10 bucks on eBay and you get 50 of them. And they're little, they're little like cotton tipped Q-tip that you put on your hand, and you don't get it inside the wound. It is not for treating the wound. It is for treating the skin around it so the Band-Aid or duct tape or whatever you're going to use sticks on. So especially great if you're doing blisters or if you're doing like steri strips. My biohazard kit, this has gloves. Now I keep 3 pairs of gloves and I keep them in 2 packs. That way they're easy to get to and I don't have to touch the outside of the glove when I pull them out. So I can touch the paper, and then basically what they are is just 3 gloves in each one, and then I wrap them and pull them out. Why do I do 6 instead of just like maybe a pair or something like that? Well, you always tend to rip one, so I always like to have a spare glove in there and then go on either hand. So I do 3, so I have 2 sets. Technically 3 sets of gloves, but I really like it in those terms. That goes right up in here on top. Medications, okay? I keep a little bit of everything in here. This is my kit for going on a multi-day trip. I keep sugar, and if you watched our other videos on how we make our little sugar tubes or pill tubes or whatever you want to do, these are great. This is just sugar, and this is for diabetic reasons. Vitamin C packs, the emergency stuff. I like this because I can just pour it in. We can drink it while we're out there. Somebody starts getting a cold. Pepto-Bismol tablets. These are rehydration tablets for people that have problems with, they've been dehydrated and things like this. This has salt and sugar and all kinds of things in there. You can get these at REI. They're not cheap. It's about $8 for about 4 packs. Definitely recommend it. It tells you how to either take it for kids or adults or whatever, how much you should be taking at a time. But you pour this into 32 ounces of water, let it dissolve, and then take it slowly, and that replenishes all your vital things. So you have, this is Benadryl. Benadryl is great for all kinds of stuff, especially poison oak, things like that. And I always make sure they have either the name, the dosage, and what it is on the back. This particular one is an anti-diarrhea pill, which is sometimes helpful if you're in the woods and you didn't plan to drink. Tylenol, of course, what Tylenol is good for, fever reducer, painkiller. I put Aleve. I like these little tablets because I can just tear them open. You can do them in the straws like we did with the small first aid kits for the scouts, but I like them in like this. I just tear them open and it makes it real easy. This is ibuprofen, okay? Big fan of ibuprofen. So I keep a few of those in there. This is, I've got Claritin in here, which is a great product. Definitely something to have for outdoor allergies. And then I buy you can either get them like this or you can get them, in this kind of style like this, which is kind of a neat idea. And then I have anti-motion sickness pills. You have your Bear aspirin. This is 2 doses of the 325 milligram tablets, which is the dose for a heart attack. So we recommend you chew these up. So this is my go-to if I start seeing somebody that looks like they're having a heart attack. There's not a big enough dose to really do anything in there anyways, but 325 milligrams, if we have them chew on those. I've watched people be brought out of heart attacks using that product, so something definitely to have. I have my bite kit, which has my extractor in there. The Sawyer extractor, big fan of those. A good pair of tweezers. You know, I have some Sting Aid and some of the wipe for poison oak. I get poison oak really bad, so I always have that. So any kind of rashes, things like that. Again, you can use the anti-itch cream up top. This is my severe bleeding kit. So I have steri strips. I have a few different sizes of steri strips in there. I have some more of the benzoin to help steri strip stick, because they're also a product for that. I have some stitching, you know, some actual some silk threaded stitches that I can use, and I keep a couple packs of those in case I got to stitch up somebody's hand or something like that to get them going. Tampons for nosebleeds, or they could be used for the other reason. There's a half of a pin in here for if I ever had to do a tracheotomy. I don't see myself doing that, but if there's somebody there that knows what they're doing enough to do that, definitely, you know, it's good to have one laying around. I keep a triangle bandage in here. Now, if you've seen our video that's coming up on how to make your handkerchief, your neckerchief into a triangle bandage, it kind of does the same thing, but these are cheap. Pay a couple bucks for those. This is a roll of duct tape, you know, just a small roll of duct tape. A pair of trauma shears. I keep another roll of the cling tape in here. There's a repair kit for working on different things. I have, for eyes, I have eye flush or little eye drops in case somebody gets something in their eyes. I keep 2 of our packs of our instant cold packs in here. So these are the same deal. These have been field stripped, so they're kind of the ones you'd have to crush the packet, and that's going to give you the coldness. This one is a little different in the fact that it's going to be, you add water. So you add just as much water as crystals. You'll see these, we show you what this is, but basically we take the packet, we cut them open, we take out the water bladder that's in there and get rid of that, because those always pop whenever you put them in the kit. So I've had problems with that in the past, so I started field stripping. So I use a Ziploc bag that is a freezer bag, and I put 2 of them in there. So there's actually 2 different kits in there. And I can also use this for an inclusive dressing. If I had a chest wound or something like that, I can always duct tape that on. So, but I keep 2 of those in there. I think ice packs are definitely the way to go. We also have some 5x9 surgical dressing in here. We have an ACE bandage. We have water purification tablets, a full roll of sports tape, and a roll of gauze. Instead of having the finger splints like we have in the bigger kits, I use tongue depressors, which work great. If I have to splint a finger, I can snap them off, cut them to whatever I want. I can also use the SAM splint that comes in the kit, but this tends to work really well, and I think it almost works even a little better than the SAM split for fingers. So, and I can carry these, they weigh almost nothing. You know, I also, you know, carry a, you know, these are my fancy, you know, titanium hemostats. I like these because they're colorful and they tend not to get lost in the kit. It's easy to find them. But this would be something I'm going to use for doing my stitches or whatever I'm doing there, if I'm just pinching something off. You know, some people might be able to use them for arteries and things like that. I don't have that skill. I'm more of just getting people well enough again to where we can get them back on the road. So as you can see, this is a kit. These are not cheap kits. You know, it's not something that you're going to spend $5 on and get a decent first aid kit. I've watched people buy $12 million worth of guns and 150,000 rounds of ammo, and they have no first aid kits. First aid kits are the #1 thing you're going to need. And any natural disaster, anything like this is what you're going to need. You're not going to need some crazy, you know, most of the time you're not going to need surgery and all this other stuff because most people just don't know how to do it. So work on your first aid kit, get good quality first aid kits that covers all the basics. That you're going to have a 3-minute kit. You're going to be able to, patch up a decent sized wound. I don't keep the compression bandages in here, but I keep 5x9s with an ace bandage. I'm able to do that. I keep a tourniquet in here. If you can sit there and stop their bleeding instantly, you've got several hours to get a helicopter in like that. If they bleed out in 30 minutes, doesn't care how fast that helicopter is going to get there. It's always that joke, when seconds count, the ambulance will be there in minutes. So even in the woods, when seconds count or minutes count, they're not going to be there for hours. I've watched them in bad storms like that. They can't get a helicopter, and there may be 6-7 hours before they can get there. With a decent compression bandage and a tourniquet, you can really put some time on that span. If you've got somebody that's been bitten by a snake, we can increase their time without having to cut them or do anything else with an extractor kit. Maybe they're allergic to bees or they're allergic to bug bites or whatever it is. We can have the extractor that can, stretch out that time. Some ice packs. If we're able to put some ice on somebody and get them cooled back down, we can put this on the back of their neck for somebody that's, hyperventilating, or they've got some heat stroke going on. If we put that on the back of their neck, that can really bring them right back out of that. So ice, they sprain an ankle, strapping an ice pack to there really does help with that swelling, allows them to put back on their boot. A lot of times people don't understand that when they sprain an ankle, they go to take off their boot to look at it. By the time they try to put it back on, their foot swelled so far that it won't allow their foot to go back in the boot. And they're stuck where they're at. Blisters, same way. Anything where we can put that cold pack back on there and try to get that, the swelling back down is a good thing. And some simple antibiotics. Scout leaders, you're going to have to ask your parents about this. This is something that should be packed in their personal kits. I happen to bring my own son with me, so I have this for myself and him. You'll have to check with your area of scouting on whether what you're allowed to give them, and ask your parents what's approved to give them. If maybe they're allergic to something. You should know these things before you leave. Make sure that if they need something, you can always add a couple of their pills into if they need something, maybe they have migraines. You want to put Excedrin in, or whatever you want to do, you could put that in there. And that's going to be a huge benefit. Triangle bandages. But we're not talking about a $5,000 kit here. You can do basically a lot of this stuff very simply. Do I need the steri strips? No, I could get away with butterfly bandage, and they work very, very well. The steri strips are more expensive, but they're better. So just kind of keep that in mind, guys. Really, good quality kits are worth their weight in gold. And you are supposed to be building them. That is part of the scouting program. They have to build not only a group kit, but a individual first aid kit. So we really want to push that. And you should be carrying, for all your big events, you should be carrying a full-size kit with you. So this is the Black Bear Prepper. If you guys have any questions, please leave comments down at the bottom. Like us if you like our videos. Tell your friends about us. That's how we are able to keep doing these videos and allowing us to be able to come back and show you these guys and get them out as quickly as we can. We usually try to put out, 1 or 2 every couple weeks. Hopefully we'll increase that, and you're going to see more coming up on the first aid side of this. We're going to be putting a first aid section in, and we're going to be going through the first aid part of the Scout Handbook. We're just going to go through that whole thing and explain all the things that are in there and how to do all those items. So that's going to be kind of what's coming up next. This next month at our roundtables, we're going to be talking about tents and sleeping bags, what to look for, what to buy. So this is Tate. As always, have a great day.